This is the continuation of endocrine system. Now we will review adrenal gland. The adrenal glands are a pair of roughly triangular or pyramid-shaped glands found or sit on top of each kidney like caps and are embedded in the adipose tissue enclosing each kidney. The adrenal glands are also known as suprarenal glands because of their position as it is on the superior of kidneys. Instead of being one gland, though, each adrenal gland is actually two distinct glands. The adrenal glands are each made of two distinct layers, each with their own unique function. The outer layer is called adrenal cortex and the inner layer is called adrenal medulla, each secreting different hormones. The adrenal medulla is closely connected with the sympathetic division of the autonomic nervous system, and the adrenal medulla consists of modified neurons and appears more like a mass of nervous tissue than a gland and functions as part of the sympathetic nervous system. The medulla is neuroendocrine tissue which secretes adrenaline into the bloodstream in response to activation of the sympathetic nervous system. The outer portion called the adrenal cortex is glandular tissue and secretes steroid hormones called corticosteroids. Hormones from the cortex are steroid compounds derived from cholesterol. Both the adrenal medulla and the cortex are well supplied with blood vessels. Now we will see each one in detail. The outer part of each adrenal gland, the adrenal cortex, is made up of three distinct functional layers of cells. Each layer is involved in the production of steroid-based hormones, collectively known as corticosteroids. The adrenal cortex synthesizes more than 30 corticosteroids. This synthesis begins with the cholesterol using a variety of intermediate substances in relation to the hormone being made. Steroid hormones are not stored in cells, and their rate of release is based on their rate of synthesis. Some of these hormones are vital for survival, especially aldosterone, cortisol, and some sex hormones. The adrenal cortex consists of layers of cells, including an outer zone or called the zona glomerulosa, a middle zone or called zona fasciculate, and an inner zone that is called zona reticularis. The outermost layer, zona glomerulosa, secretes the mineralocorticoids. The middle layer, zona fasciculata, produces the glucocorticoids. The innermost layer, zona reticularis, is also involved in the production of glucocorticoids but also produces small amounts of adrenal sex hormones, the gonadocorticoids. So corticosteroids are glucocorticoids or cortisol, mineralocorticoids or aldosterone. So what is glucocorticoids or cortisol? It has many diverse functions, including the breakdown of proteins and lipids to produce glucose. It also functions to reduce inflammation and immune response. They have an anti-inflammatory effect. They also suppress the immune system if secreted over a long time. Glucocorticoids help the body adapt to stress and repair damaged tissue by stimulating the breakdown of fat and protein, converting fat and protein to glucose, and releasing fatty acids and glucose into the blood enhances tissue repair. Glucocorticoids are essential for maintaining a normal blood pressure. Secretion of cortisol follows a circadian rhythm with high levels early in the morning and low levels at the time of sleep. What are the effects of glucocorticoid hormones in our body? They influence the metabolism of most body cells. They promote glycogen storage in the liver. During fasting, they stimulate the generation of glucose. They increase blood glucose levels. They are involved in providing resistance to stresses. They potentiate the vasoconstrictor effect of catecholamines. They decrease the permeability of vascular endothelium. They promote the repair of damaged tissue by promoting the breakdown of stored protein to create amino acids. They suppress the immune system and suppress inflammatory processes. The name of glucocorticoid hormones are cortisol or hydrocortisone, cortisone, corticosterone. Cortisol release is stimulated by adrenocorticotropic hormone from the anterior pituitary gland. ACTH releases cholesterol from the cytoplasm in the cells, which is then converted and modified to create the steroid hormones. ACTH secretion is regulated by the release of corticotropin releasing hormone from the hypothalamus. Increasing levels of cortisol have a negative feedback effect on both the hypothalamus and the pituitary gland, inhibiting for the release of both CRH and ACTH. However, this negative feedback system can be overridden by acute physiological stress, for instance, trauma, infection, or hemorrhage, and mental stress. The increase in sympathetic nervous system activity in response to an acute stress triggers greater CRH release, and thus there is a significant increase in subsequent cortisol production. The outer adrenal cortex or zona glomerulosa synthesizes aldosterone, a mineralocorticoid that helps regulate mineral electrolyte concentrations. Mineralocorticoids are the group of hormones whose main function is the regulation of mineral salt or electrolyte concentration in the extracellular fluids, mostly regulating sodium and potassium. The regulation of sodium is connected to the regulation of potassium, hydrogen, bicarbonate, and chloride. The regulation by mineralocorticoids of sodium and potassium is vital for overall homeostasis. The aldosterone helps the kidneys to balance sodium and potassium and stimulate water retention via the process of osmosis. If blood sodium decreases or blood potassium increases, the adrenal cortex secretes aldosterone. The kidneys also stimulate aldosterone secretion if blood pressure falls. Aldosterone secretion is stimulated by decreased blood volume and pressure and raised blood levels of potassium. Therefore, the aldosterone secretion is inhibited by the opposite conditions like increased blood volume and pressure and decreased blood levels of potassium. Aldosterone also enhances the absorption of sodium from gastric juice, perspiration, and saliva. It has regulating effects that occur within 20 minutes, allowing precise control of plasma electrolyte balance. The activity of aldosterone involves synthesis and activation of proteins needed for sodium transport. There are several mechanisms that regulate the release of aldosterone. The primary control mechanism is the production of angiotensin II by renin-angiotensin system in response to reduced blood pressure in the kidneys or reduced sodium delivery to the distal tubules of the kidneys. Next hormone from the adrenal cortex is androgens or testosterone. They are produced at low levels in the adrenal cortex to regulate the growth and activity of cells that are receptive to male hormones. In adult males, the amount of androgens produced by the testes is many times greater than the amount produced by the adrenal cortex, leading to the appearance of male secondary sex characteristics. Androgens stimulate the development of pubic and axillary hair and sustain sex drive in both sexes. The sex steroids also include small amounts of estrogen. Because the amount is very small, it has little importance during reproductive years. However, it is the only source of estrogen after menopause. Next is adrenal medulla. The adrenal medulla is the inner part of the adrenal gland. It makes up about 30% of the total mass of adrenal gland. The adrenal medulla contains modified neurons called chromaffin cells that act as part of the sympathetic nervous system. The adrenal medulla is mostly a modified, densely innervated sympathetic ganglion made up of granule-containing cells. Within the adrenal medulla, approximately 90% of the cells secrete adrenaline and the remaining 10% secrete noradrenaline. So, the function of the adrenal medulla is the secretion of catecholamines. They are epinephrine or adrenaline and norepinephrine or noradrenaline. They are secreted under stimulation by the sympathetic division of the autonomic nervous system. Both of these hormones help to increase the flow of blood to the brain and muscles to improve the fight or flight response to stress. These hormones also work to increase heart rate, breathing rate, and blood pressure while decreasing the flow of blood to and function of organs that are not involved in responding to emergencies. So, these catecholamines prepare the body for physical activity by increasing heart rate and blood pressure, stimulating circulation to the muscle, and dilating the bronchioles to maximize blood flow to the areas needed for physical activity. They also inhibit digestion and urinary production. It also boosts glucose levels, which is a source of fuel, by breaking down glycogen into glucose and converting fatty acids and amino acids into glucose. What are the effects of catecholamines in our body? They stimulate the nervous system, they have metabolic effects, they increase metabolic rate, they increase heart rate, they increase alertness. Noradrenaline causes significant vasoconstriction. Adrenaline causes vasoconstriction in the skin and viscera, but vasodilation in skeletal muscles. The secretion of catecholamines from the adrenal medulla is initiated by sympathetic nervous activity controlled by the hypothalamus and occurs in response to pain, anxiety, excitement, hypovolemia, hypoglycemia. The medulla receives its blood supply from the adrenal cortex rich in corticosteroids. These regulate the production of the enzymes that convert noradrenaline to adrenaline. Thus, an increase in corticosteroid production leads to an increased conversion of noradrenaline to adrenaline. The adrenal medulla secretes adrenaline into the bloodstream with a little noradrenaline when a person is frightened, alarmed, or excited. These hormones prepare the body for action that is called fight, flight, or freeze by increasing the rate and force of heartbeat, increasing the rate of breathing, converting glycogen to glucose, alerting bladder or bowel control, dilating the pupils, increased blood pressure, dilation of the airways, increased metabolic rate, increased blood flow to skeleton. This happens by diverting blood from the skin and gut to the skeletal muscles. Because of that, a person may develop a pale skin or a sinking feeling in the stomach. Next gland is gonads. They are ovaries in females and testes in males. They are responsible for producing the sex hormones of the body. These sex hormones determine the secondary sex characteristics of adult females and adult males. The testes are a pair of ellipsoid organs found in the scrotum of males that produce the androgen testosterone in males after the start of puberty. Testosterone has effects on many parts of the body, including the muscles, bones, sex organs, and hair follicles. This hormone causes growth and increase in strength of the bones and muscles, including the accelerated growth of long bones during adolescence. During puberty, testosterone controls the growth and development of the sex organs and body hairs of male, including pubic, chest, and facial hair. In men who have inherited genes for baldness, testosterone triggers the onset of androgenic alopecia, commonly known as male pattern of baldness. The ovaries are a pair of almond-shaped glands located in the pelvic body cavity, lateral and superior to the uterus in females. The ovaries produce the female sex hormones progesterone and estrogens. Progesterone is most active in females during ovulation and pregnancy, where it maintains appropriate conditions in the human body to support a developing fetus. Estrogens are a group of related hormones that function as the primary female sex hormones. The release of estrogen during puberty triggers the development of female secondary sex characteristics such as uterine development, breast development, and the growth of pubic hair. Estrogen also triggers the increased growth of bones during adolescence that lead to adult height and proportions. In addition to the glands of the endocrine system, many other non-glandular organs and tissues in the body produces hormones as well. The cardiac muscle tissue of the heart is capable of producing the hormone atrial natriuretic peptide in response to high blood pressure levels. Atrial natriuretic peptide works to reduce blood pressure by triggering vasodilation to provide more space for the blood to travel through. ANP also reduces blood volume and pressure by causing water and salt to be excreted out of the blood by the kidneys. The kidneys produce the hormone erythropoietin in response to low levels of oxygen in the blood. Erythropoietin released by the kidneys travel to the red bone marrow, where it stimulates an increased production of red blood cells. The number of red blood cells increases the oxygen carrying capacity of the blood, eventually ending the production of erythropoietin. The hormone cholecystokinin, secretin, and gastrin are all produced by the organs of the gastrointestinal tract. These hormones help to regulate the secretion of pancreatic juice, bile, and gastric juice in response to the presence of food in the stomach. Cholecystokinin is also act as an appetite suppressant and plays a role in regulating intestinal motility. Adipose tissue produces the hormone leptin that is involved in the management of appetite and energy usage by the body. Leptin is produced at levels relative to the amount of adipose tissue in the body, allowing the brain to monitor the body's energy storage condition. When the body contains sufficient levels of adipose tissue for energy storage, the level of leptin in the blood tells the brain that the body is not starving and may work normally. If the level of adipose or leptin decreases below a certain threshold, the body enters starvation mode and attempts to conserve energy through increased hunger and food intake and decreased energy usage. Adipose tissue also produces very low levels of estrogen in both men and women. In obese people, the large volume of adipose tissue may lead to abnormal estrogen levels. In pregnant women, the placenta produces several hormones that help to maintain pregnancy. The placenta secretes estrogen, progesterone, and other hormones that help maintain a woman's pregnancy. Progesterone is produced to relax the uterus, protect the fetus from the mother's immune system, and prevent premature delivery of the fetus. Human chorionic gonadotropin is a hormone produced by the placenta during pregnancy. It helps thicken the uterine lining to support a fetus and tells the body to stop menstruating. HCG levels rise after conception and continue to rise until about 10 weeks in pregnancy. HCG assists progesterone by signaling the ovaries to maintain the production of estrogen and progesterone throughout the pregnancy. Prostaglandins and leukotrienes are produced by every tissue in the body except for blood tissue in response to damaging stimuli. These two hormones mainly affect the cells that are local to the source of damage, leaving the rest of the body free to function normally. Prostaglandins cause swelling, inflammation, increased pain sensitivity, and increased local body temperature to help block damaged regions of the body from infection or further damage. They act as the body's natural bandages to keep pathogens out and swell around damaged joints like a natural cast to limit movement. Leukotrienes help the body heal after prostaglandins have taken effect by reducing inflammation while helping white blood cells to move into the region to clean up pathogens and damaged tissues.